Afternoon. On May 27th of this year, I actually fractured my arm. And as a result of that, I have been undergoing physical therapy for now about 10 weeks. And I am going to Novant Health's physical therapy department on Baldwin Avenue. I share that because that particular facility takes care of all patients, including babies, pediatric patients throughout the lifespan. And I'll share a story with you that has actually become very meaningful to me as a patient, as an employee of Novant Health, and also as a leader of Novant Health. The week after I had gone for my initial visit, I was sitting out in the waiting room, and each time I go for my physical therapy, I take off my name tag because I just, don't want individuals to know necessarily that I'm a team member at Novant Health, because the first time I went, the waiting room was packed. And I was surprised actually, because I didn't know I was going to see babies there and everybody else. So at my second visit, I sat beside a mom and a dad and a grandmother, and they had two babies in their little bassinets, or not bassinets, but their little carriers. And so I actually started the conversation. I said, "Oh my goodness," I said, "how old are the children?" And so just to shorten up the story, 18 months of age is the age, and they had been in the NICU at Presbyterian Medical Center for a total of 12 weeks, which that said to me, okay, they have experienced some probably pretty significant medical conditions within that 12 weeks. So the conversation went on, and I said, "So how was your experience in the NICU?" They immediately started talking about the nursing team, very positive, the neonatologist. And then the mom actually got a little more specific. She said, "We have seen every specialty that I think there is to see." I said, "Oh, really? So what all, who all have you seen?" And she said, "Well, we've seen the heart doctor, we've seen the lung doctor, we have seen the infection doctor, we've seen the neurologist." And she said, at first it was overwhelming. But she said, "I cannot say enough about the impact that these four entities have had on us as a family. Just to and she said, "We had no idea that Presbyterian had all of these services to offer us with sick babies in the NICU." And she said, Adam, that was one of the little boys, there were two boys, she said, he had hydrocephalus. And she said, we've gone through so much with him. And she said, again, so many conditions, we thought we were going to have heart problems and everything. And she said, it's just been, she used the word remarkable. And she did not know who I was or what my role, that I was an employee at Novant. So, we kind of ended the conversation because I got called back to go see my therapist. And then a couple weeks later, they were there, and I don't know, you probably don't know, but if you're scheduled for 1 time a week or 2 times a week, it's amazing. You end up seeing the same people if you're scheduled the same time, and they do that so that you see the same therapist as you're getting your treatments and all, which is a great plan in itself. So a couple weeks later, I saw them again, and the dad was not there, but the grandmother and the mom were there. So I asked how things were going, and things were good. And at that point, I shared who I was, and I said, I'm oversee Women's and Children's Services. And again, I appreciate the comments that you made, and I'm just curious, is there anything else you would like to share, even if it's some constructive criticism, because that would be very helpful. She just went on again about the continuity of care. She didn't use that word, but that's what she was talking about, and how in the follow-up after discharge, they were still seeing the pediatric pulmonologist for both babies with their respiratory condition. And she said, just to have everything here, you know, their office right across the street has been so great for me. And I have seen them a couple times since then as well. This has had a lasting impact on me for several reasons, but I bring it up today because I am here to share with you some financial information. First of all, about where we're at with program investments within pediatric subspecialty. I will share with you our plan to change that for the betterment, hopefully within the next couple months for the remainder of the year. And then I also want to share with you our plan for 2020 going forward to ensure that we keep these critical services for our children at Henry Children's Hospital. So first of all, you have a summary sheet of the program investment year to date. There are more program investments than I alluded to with this story. There are a total of 6 program investments there. And you can see that with all of them, we are not at budget. Now, having said that, they are all program investments. There are several reasons for that. One is we're not meeting our volume targets. So when you look at the budget, you will see that we're falling short about 10% from our volumes of what we had budgeted for. In terms of that, expenses have not been cut back accordingly to that 10% decrease in volumes. So the revenues, the expenses are not matching. So we need to do a better job with looking at that provider to staff ratio. And if you will look at the budget for July, you will see that we are making improvements in that. So that brings me to one of our action items for the end of the year. We are going to be changing our staff to provider ratio in 2 of the program investment clinics. We are also developing a plan to look at how do we get out into more surrounding communities to connect with more referral potentials, since we do have transport capabilities of bringing in particularly newborns and young pediatric patients. So that's a second action.
And I'm going to bring you to a close for the sake of time, and because I think she's like, I want to get this last point in.
Okay, so my third component, and one that has already been to the contracts committee meeting, and that is with 3 of these providers, their 2-year contract is up. So the question that came before contracts, were we going to guarantee a 3rd year? The answer to that is we are proposing to guarantee a salary but decrease the base rate for the 3rd year significantly, and you will see that on the spreadsheet. Now with that plan, I want to say that we are going to monitor all 3 of those outcomes. And the plan is to come back in 6 months. We're not going to wait a year, but come back in 6 months and share with you where we're at and then where we plan to be going forward. Have more.
I know you do.
That's it for a second.
Okay.
So how does that feel?
The story feels good. I mean,